When I first took up post for the Homeless Public Health Nurse for the Western Trust, the COVID lockdown had just come into place. I had to adapt the role very quickly to meet the needs of those experiencing homelessness within the city. And this involved going out to the hostels, meeting with clients who had health needs, doing a nursing assessment, linking in with their GPs and getting an assessment, diagnosis and a treatment plan in place to address their health need. Also, at times this would be linking in with the hospital to assert if they need A&E emergency medicine. So today we just did a review health assessment on one of the clients in the Simon community, and this was at the GP's request. Previously I've done the vital signs and they were not normal, so I've come back today and checked them, and I'm going to link back in with the GP, let them know the results, and we'll do a future plan. As part of the Homeless Public Health Nurse, the role has developed and it now includes carrying out COVID-19 testing within the hostels for those presenting with symptoms or those who have been in close contact with somebody who has tested positive for COVID-19. This year, with the pandemic, it has been crucial that we deliver a flu programme to our most vulnerable in society. Here we've organised and carried out a flu programme within the hostels and in the drop-in centre of DePaul, reaching those hard-to-reach clients so they're protected of flu this year.
So I am Jamie Wallace. I'm the project group manager for the DePaul services in the West. We would support any individuals who are homeless, at risk of homelessness, or experiencing any complex issues like addiction, mental health or physical health issues. Michelle came on board with DePaul and the homelessness sector in February 2020. Michelle has made a massive impact to our service users through the clinical side of things, through physical health, definitely through speeding up prescriptions and strengthening those relationships within the mental health and physical health sector.
We work in close partnership and we're in contact 2 or 3 times a day with regards to our clients. And without DePaul services and support, it makes my job possible. Because they help support the clients get to their appointments and then their health needs are met through that support.
Michelle has been absolutely invaluable through COVID-19, certainly through the screening of patients, giving us advice when patients would display symptoms or have any worries or concerns. Michelle is also now administering the flu jab as well, which has made a massive difference because due to a cohort of our clients, they won't go to a clinical setting, so Michelle certainly being within the day centre administering that has made a huge difference to the health as well.
Michelle? Yeah? Okay, so we've just completed a staple removal from an old head injury, and this allows the client to have this procedure done here on site rather than going to a treatment room or to any department.
So that one of our homelessness patients treated today is high risk as far as podiatry needs concerned. He has a history of cellulitis and lower limb ulceration. If I wasn't here, I'm bringing our care out into the community with him to avail of our services. So that's where we're vital, not only in treating his feet and his legs, but also signpost onto other disciplines like GP services, mental health services. And through this project, we hope to continue having a wraparound approach and looking after it, evaluating them, assessing them, and being there for them whenever they need us.
On a daily basis, I would go out onto the city, onto the streets, and meet with clients and just assess their health needs, if they have any health needs that day. And if not, we just be building rapport with each other. Sometimes I work with connecting primary care and secondary care together. And today I'm looking for somebody who's got an appointment with a hospital consultant neurologist and they don't have a mobile phone and it's quite hard to reach them. So when I do my walkabout, I'll try to find them and tell them the importance of this appointment and work with their support workers so they can take part in this consultation. As part of the outreach work, on occasions I've had a call in the ambulance to help with emergency medication on the streets to support the person with their health needs so they are safe and taken to hospital.
So in my current role as the Substance Misuse Liaison Nurse in Altnagelvin, a lot of my patients have coexisting alcohol and drug problems, and they are homeless as well. In the past, it was really hard to plan for their care once they left hospital, because just due to the nature of their lives, whether they didn't have a fixed address, whether they weren't able to engage in services, or services have really low thresholds for engaging with them, having Michelle has been really, really useful, because I can refer to her, we can have a conversation about it, she can get in touch with the patient directly, or she can meet them in the community. It's really a service that we really, really value here within this acute setting, and we're able to get better discharge plans and outcomes for patients.